So we have another, let's say, maximum 15 minutes for question and answer session. So I'll open the floor for questions and answers. We already listened to 4 presentations. Yes, 4. So if you have any comments or questions, please, now the time, you can ask the questions, Yes, the floor is open now.
May I ask a question, Dr. Sheikh? Thank you very much, very nice. May I know how you did this calculation? What is the reference?
So the reference, the data reference we used is contraception methods we provided in both the situations for 3 years, and we took that and then used MSI tool where each of the methods like condom, the oral pill, and those things they calculates with the conversion factor of CYP and then calculates the other impact indicators. So those were the risks.
So all these aborted, unsafe abortions aborted, all were calculated?
Yes.
Because you haven't given...
Yes. Yes. They are in the methodology.
And my next question to Ms. Sattanayaka, I think this and your presentation, Tamas, is both are penal code, and this discussion has going on for the last 30 years. I joined the STD AIDS control program in 1980. We discovered the first HIV patient also in 1980. Then we have been talking about and this be about the time here in Francis. Our UNICEF consultant, Madam Soma, is here. She also will agree with me. She also has attending all these. We are still at a full. So we would like to know from the University of Sociology and of Faculty of Law, how will you give the leadership? Because unfortunately, although I have been in the health ministry, I'm very sorry to say that push has not been very hard. Now time to hand it over to somebody else can do the needful. So I will ask from the chairperson as well as from the two of you, what are your future plans to change this penal code talking about? We are always criticizing British laws and whatever they have instituted here. But what are you all going to do about this? This is very timely question. Over to the two of you and to the chair.
So I think we will first ask the last presenter to answer, because she has already recommended to change the existing law, which is important, and because we also would like to know, what are your views on this, how we could change it. Yes, is she there?
Tamasha is there.
Thank you so much for the opportunity. So basically, my research was on decriminalizing abortion law for the rape victim. So there has been attempts in 1995, in 2012, 2022 to amend the penal code to give the choice of abortion to these rape victims. But as an academic, so we can contribute through research, and we can contribute through research for all these policy reformations, so and so. But I think it is a collective effort of academia and the implementation institutes, NGOs, and I would say all the other government institutes to come together and work on this. But there has been efforts as such, but I think politics and the social factors play a crucial role in amending the laws. So that's why it has been unsuccessful up to now. So my suggestion is, I think again, we might have to go with another effort to come up with these solutions that can be both to ensure the recognition of human rights of these rape victims and other females. So I think it should be a collective effort. So what we can do is we can be the voice of the general public. So especially being a lecturer, that means we get the chance to change the mindset of the young individuals. So we can start from there by changing the mindset of the children that we teach, and then they will change the societal perspective, which will lead to future amendments, which will give the opportunity for safe legal abortions in Sri Lanka. Thank you.
So I also agree to what she said. I totally agree with what she said. But then also I want to say now there were so many research doing and so many things done. In 2017 or 16, as I remember, in the parliament they wanted to stop it, but then without even coming into the house, it has been rejected, saying it's culturally inappropriate. It's the situation if people are blindly going behind the culture. So then I think there's far more things we can do for like amending the law. I think first place and also that's an interesting finding in research previous study. So they say if now with the situation here with the education level and everything in the country at the moment, if we legalize if we like give it liberalize, not legalize, liberalize the law, then there'll be a higher tendency where women go into abortions rather than following any contraceptive method. So that is because of lack of education. So as she said, I think we should start it from the beginning. Like we should start from the level of education, and at some point we will be there to change the legal system. But again, we also need the support of all the not only just academics and not only just research. So from the grassroots level, like every activist, professionals, everybody's contribution is important in convincing to change the penal.
So for this amendment of this penal code, what are the collective efforts being done in the country? Like, is it just academia or researchers they are pushing it, or it's a collective effort, and who all are engaged in that? Like in some countries there are coalitions and all the agencies and academia, they come together and they...
So yes, according to my idea, so there's a lot of research being done in this area, but then some of the researchers are not seeing what the organization for this. So there's very much, like people are very much unaware what kind of things the organizations do in. But then also there are so many organizations working in the country, including Family Planning Association. So we also have partnered up with a lot of international organizations promoting this, UNFPA. So I myself worked for UNFPA for a community development project where we spoke about this part of. But then even though everyone's together, but then there's some point where we come to saying that it's not culturally appropriate, because I would say the Sri Lankan culture is more traditional and goes with the Sinhala Buddhist cultural system. It's like dominant culture is Sinhala Buddhist culture, which restricts this abortion. But again, I think it's not very not suitable for the contemporary society in some aspects. But yeah, that is the reason. So there are a lot of organizations working, especially youth working for youth organizations and grassroots organizations working for it. But still that cultural appropriate label is there, so we can't go beyond that. That is the main reason abstracts.
Okay, but it has to be a collective effort, just one effort.
So if I can add to that, in 1995, there was a amendment which was voted to amend the existing abortion law in Sri Lanka to liberalize the abortion law to allow rape victims with the choice of abortion. But the parliament bought the bill, but it was rejected because of some religious reasons. The same thing happened in 2012 as well. In 2022, the minister in charge, Minister Ali Sabri, again tabled issue regarding decriminalizing abortion for rape victims. But I would say in all these three instances, it was a collective effort of government institutes, academia, and professionals, NGOs, as mentioned by the previous researcher. But again, as I agree with her, it was even though it was a collective effort, it was unsuccessful because of the religious and the societal perspective when it comes to the abortion system in Sri Lanka. Thank you.
Hello. I'm an academic who have done research on topics of abortion. I come from a legal and gender studies background. So if you look at some of the statistics about women who get abortions, the first and the highest statistic are married women who are subject to gender-based violence, marital rape, who do not usually want a second child to endure the pains of being a part of that kind of family dynamic. That's the first. And secondly, it's a lot of young women who have been raped by close family members and have resulted in an abortion with the assistance of their mothers, because they do not encourage contraceptives. And if it's rape, then obviously, or incest, then there are other matters that come into this as well. As the earlier speaker mentioned, there were blocks with the 2012 and the 1955, right? But also another issue is there's selective abortion that is allowed within the justice system right now. And there are doctors and lawyers that work on grassroots level that try to convince people to get medical abortion under a safe space within in a healthy manner, because abortion's a very risky procedure. It's not like getting ice cream, and I don't think any person, even if they are subjected to rape, will make such a decision a very in a free and loose manner, right? And that is a myth that needs to be busted with how difficult and life-threatening abortion and the procedure of abortion itself. Those of who, I also have a forensic medicine background, so those of us who have had experience with that also may understand, especially the doctors in this room will also agree with me, I think, in the risk of abortion itself. While I am pro-abortion for all people who want to get an abortion, even for a reason for as simply as I do not want to be a mother, right? Because that is also a distinction we need to understand about a people's choice, that a child does not deserve a parent who do not want to be a parent, right? And it is as simple as that, right? Because like I said, there is selective abortion that we may sympathize with, right? Oh, if you're raped, then it's okay. If you are a person who is come to financial issues, then it's okay. If your religion says don't have a fifth child, then it's okay. But no, if I don't want a child, I should not have a child. And I think we have more than enough children who have been forced into having parents who are abusive. We do not want children to be born into resentful parents anymore. And to mitigate child abuse, we should give rise to choice for abortion as well. Thank you.
I think those comments are very, very useful. Thank you very much for enlightening that. Next question, please.
Just building up on what was shared, I am Hasini Rupasinghe. I am representing the Asia Pacific Resource and Research Center for Women, and I specifically work on a project called a Safe Abortion Advocacy Initiative, a Global South engagement. We are an organization as well as a platform for Global South advocates and activists, even academic service providers, working towards advancing safe abortion as a human right and increasing access to safe abortion. In terms of the question that was posed as to whether there is any form of concerted effort in Sri Lanka to push for decriminalization yet again, there is a safe abortion coalition that is being formed, but it is kept very much under the radar because we want to be well organized and well prepared to even put forward something as simple as a position paper. Of course, if there is a move by unfortunately religious or politically led movement to make amendments to the law that are not helpful, like for example in 2016 or 17, I believe there was a move to include 3 exceptions in addition to what is permitted under the penal code, which are in the case of a rape, and in the 2 more in the case of a rape, and also in the case of a fetal abnormality. But recently we heard that there was that steps were being taken to include an exception of lethal abnormality, which is actually a step back and not a step forward from the progress that was made by the abortion rights community in Sri Lanka a few years back. So that's something that we have to be prepared to counter as safe abortion advocates and even as allies. So that's something that's going on within the civil society realm in Sri Lanka. And also, as to what was shared by a member of the audience here, I beg to differ on the point about whether abortion is obviously it's if a decision is being taken by a woman to have an abortion, it's a very difficult, maybe a very difficult decision that involves a lot of a lot of things that culminate into you deciding to have an abortion, and that is the right over your body. That's your bodily autonomy put in practice. But if you look online and things that have been said by the World Health Organization and organizations like the International Planned Parenthood Federation, abortion is a medical procedure that's very safe. It can be done by qualified professionals, as what was shared during the plenary session in the morning. So it is important that we view abortion as much as we view it as a right, also as a part of healthcare. you have a right to health. Abortion is part of healthcare, and therefore you have a right to abortion. And it is a right, it is part of healthcare as much as part of childbirth. That is the view that I believe we should adopt when we view abortion. Of course, it's difficult to push these views with the formal sector, so that is why we look at certain exceptions to the already criminalized abortion and say, oh, look here, if we can't have a fully decriminalized abortion, let us have these exceptions, because what will happen to a girl who is raped and with child, so, or any other forms of sexual abuse that happens to women and girls in all their diversity, that results in a pregnancy that is unwanted. So just sharing my thoughts here and answering one of the questions that was posed.
Yeah, thank you for the question, madam, and also we got different answers. I think so we have to stop now because it's 2:15, and so I would like to thank all the presenters for their very constructive presentations, and I also would like to just to think about some of the important concepts which emerged out of these presentations, like cultural sensitivity, culture, norms, changing of laws. I think these are very important, and as we discuss, still we struggle to change some of the abortion related laws, and so I think our culture, we have I would say, like as a sociologist, most of the points are hidden, so we don't openly discuss even after introducing open economic liberalization policy since 1977. Still I would say we live in a very closed society, so therefore somehow we have to make an attempt to openly discuss these important issues. I hope something good will happen to us in the future, which we have to, and also we have to change the public opinion, because how much effort we put to change these opinions are also very important. So you as practitioners, researchers, academics, you also have to, as we discuss here, you have to do a lot, yes. So it's not an easy task. So with this message, I would like to conclude the session, and madam, we have to now give the certificate.